behalf of our foundation, the John R. Oshai Foundation, the P2 Collaborative of Western New York, and the UB Regional Institute, I'd like to welcome you to this Reaching for Excellence speakers event. Just as a brief update on Reaching for Excellence, you'll recall that a big part of that project was an activity called One Friday, Four Futures, which were meetings all over the region with folks to talk about what people want out of the healthcare system in 20 years. And I want to tell you, we finished that phase of the project and we had over 110 meetings around the region with over 1,500 folks, people, talking about what they as users of the healthcare system want from that system. So the next step in that project is to summarize the themes that we heard and try to build a community-driven dashboard of what the healthcare system needs to be accountable for. So stay tuned for more of that aspect of Reaching for Excellence. But as I said, today we're really coming together for the fourth in our Reaching for Excellence speaker series. Several organizations are also sponsoring this event, and they're listed on your program. But before I introduce our speakers for today, let me go through the event, just so you know what's going to be happening, particularly if you haven't been here before for one of these events. Each of our participants will spend about 20 to 25 minutes talking with you about their perspective on the issue of achieving health equity and reducing disparities. And then we'll have a discussion among ourselves and with you addressing questions that come up for you. In your folder is an index card on which you can write a question, and there's also a pad of paper for those of you who are really oriented to questions. You can write as many questions as you want on that paper. All you need to do is raise your hand, someone will come around and pick it up, and we'll be answering those questions here after their presentations. Just an added note of interest, we've gone digital, just like everyone else, and today we have a simulcast of this presentation on the web for several people who were not able to come today. We put that in place particularly because of the geographic distance in the region and the real unpredictability of the weather. So this will allow people to participate, and they'll be able to ask questions over the web as well. We'll break at 5:30 for a reception, and our guests will be able to spend some time with you informally as well. Now to the session for today. Disparities in health and healthcare, I think, take on an even greater importance when we look at our collective goal of achieving equity across the healthcare system in Western New York. We want people to have equal access to health and to health care. The challenge of reducing disparities, and they exist of all types, becomes greater when you think about the variety of populations and the diversity of people that we have living in our area. They exist in many forms. There's economic disparities, gender disparities, rural-urban disparities, and today we're going to talk about those disparities that have been shown to manifest themselves when we look at race, ethnicity, and language barriers to health and health care. In this wonderful brief that the University of Buffalo Regional Institute put together, it leads with this powerful quote from Dr. Martin Luther King that of all the forms of inequality, injustice in health care is the most shocking and inhumane. And that's why we're starting with inequities in health as a major effort here in Western New York. Today we have two guests who work every day in addressing these disparities, one in Florida and one based in Boston. Their bios are in the material that you have, so I don't want to spend a lot of our time together going through that, but I think you'll see that they're people who are working very closely with this issue, trying to figure out not only the immensity of the problem, but strategies that can be used and tapped and implemented to really make a difference and reach that goal of health equity. There's much to be done together, and the work is really hard. You'll see in some of this material how difficult it is to get to a situation where we really have equitable access to health care and equitable health status. It was interesting because just today in the Buffalo News, I don't know if you saw it, where is it here? Pardon my disorganization. Just today, the headline is Racial Gap Widens in Fatal Colon Cancer Rate. That was today. Last week, there was one that talked about the difference in heart disease for women versus men. Oops, sorry. And another that talks about obesity is tied to zip code. So we see a number of ways in which disparities can emerge, and that difference in how they arise has a lot to do with differences about how we go about addressing them. I think one of the powerful messages that you'll hear today and that you will read in the brief is that it takes all of us to fix these disparities. It's not just the healthcare system's responsibility, but they have a big part to play in how they welcome people, how sensitive they are to the cultural and ethnic and racial diversity of the community, how equitably care is provided, how equitably tests are given, early diagnosis, outreach. They have a big part to play in all of this. But so does the community as a whole. The latest document from the Department of Health that talks about prevention and health improvement says that less than 10% of our health status is due to the health care that we get. The rest of it is due to where we live, how we live, behavioral issues, both personal behavior and community mores, standards. And so we have to think about the issue of achieving health equity in Western New York as something that involves the whole community. To start on that process, we have just this week launched a work group called Health Equity in Western New York. We welcome all of you to participate. You'll hear more about it, and it's an opportunity to come together to look at both community approaches, how we get the data that we need to improve care, how we mobilize community support, and how we work towards a healthcare system that is culturally proficient in dealing with the wide variety of folks that we have in the region. So with that, I think you've heard enough from me. I'd like to introduce our guests. We have two, as I said, really wonderful people who talk with us today about these issues of disparities and specifically strategies to address them. We invited these two people because while they're very knowledgeable, as I said, about the extent of disparities, they also can point to very specific things that communities have done and can do to make a dent in this problem. Rochelle Ayala is the Administrator and Chief Medical Officer for Primary Care Services at Memorial Regional Hospital in Hollywood, Florida. And that hospital serves, and her primary care services serve primarily uninsured Floridians. So she has a population that really has the potential to both experience significant disparities and see improvement in that. Our second presenter is Roderick King. Dr. King is the senior faculty on something called the Disparities Solution Center of Mass General Hospital and is on the faculty at Harvard. He was a lead author on a wonderful article that we're going to use as kind of the blueprint for our health equity in Western New York effort. And you'll hear from both of them their strategies and what could be our strategies for moving forward. After they present, though, the best is really the dialogue that comes among us and with you. So please don't hesitate to put in those questions. Raise your hand if you have one, and we'll be talking together after their presentations. So please join me in welcoming Rochelle Ayala.